Hello, today we're going to be solving the Medicare puzzle. Let me go ahead and share screen here. How to solve the Medicare puzzle. So let's face it, Medicare can be confusing and overwhelming. There's a lot of rules and deadlines and many scenarios that require a unique path. So that's why we make Medicare simple to understand and the process easy. My name is John Riley. I'm president of Riley and Associates Insurance Services. We're an independent insurance agency specializing in Medicare. For 2 decades, we've worked in the employer benefits health space before transitioning our business to Medicare. So we have a deep understanding for employer health benefits, as well as COBRA, individual plans, as well as, of course, Medicare. So today we specialize exclusively in Medicare. And we built a specialized team, processes, and systems to ensure you get the same high level of customer care every single time. So whether you're an individual that needs help or you have clients or employees that need support and education, we can be your trusted agent and partner. We work with different plans, many different plans and carriers, and there's no charge for our services. Our mission is to make Medicare simple and the process excellent for everyone. We believe that our investment in these core areas delivers the kind of experience that you'll want to tell your friends and family members about. If you have any questions, you can drop them in the chat at the end. I'll be happy to answer those. Or if you'd like, we can set up a one-on-one call and I'd be happy to answer all your questions. Okay, so let me go ahead and jump in. Our agenda for today is very simple. We're going to keep it to the basics of Medicare. We're going to talk about your 2 options because you only have 2 options, and then how we can help. Okay, so the basics of Medicare. So Medicare is health insurance provided by the government for people 65 and those with certain disabilities. It comes in 2 parts. Original Medicare is made up of 2 parts. Part A, which is your hospital insurance, and Part B, which is your medical insurance. Part A, your hospital insurance, covers inpatient and facility care, and Part B covers basically everything else. It covers your doctor visits, your labs, your x-rays, outpatient surgery. Okay. Part A generally has no premium. As long as you or a spouse have paid into the Social Security system through payroll deductions for 40 quarters or 10 years, then you're not going to pay a premium for Part A. For Part B, there is a premium, however. It starts off at $202.90. You're going to pay that for life, and it's going to be increased a little bit each year with inflation. Now, it's gauged to income. So the more you make, the more you're going to pay. So it starts off at $202.90 per month, and it can go up based on your income. And we'll take a look at that chart in just a minute. So you're going to fall into one of 2 camps. Either you're under 65, getting ready to move into Medicare, or you're still working and going to be retiring soon and need to get Medicare. So we're going to look at both scenarios today. So let's first look at the enrollment periods. So for those in Camp 1 that are going to be turning 65 soon, you're going to be in your initial enrollment period. It gives you a 7-month window. So you have 3 months before your birthday month, 3 months, the month of your birthday, and 3 months after your birthday. Okay, so we suggest that you set up a discovery call 3 to 4 months before your birthday. And then that way we can take you through kind of your options. We can answer your questions. We can get you all set up and how to enroll in original Medicare so that everything becomes effective on the first day of your birthday month. Okay. If you're in Camp 2 and you're going to be retiring soon, your benefits or your open enrollment window is actually going to start on the first day of your retirement or when your benefits end, whichever comes first. And you've got an 8-month window. but the process is very simple. We wouldn't recommend you wait. You want to set up a discovery call 3 to 4 months prior to your birthday or to your retirement rather. And then that way we can kind of go over your options. You're going to have a couple more steps that you'll have to take. And so it's important to know, what that path looks like. Okay. There's also a few other enrollment periods that you should know about. The first one's called the annual election period. And that is the time where you're going to review your benefits before the new year. So throughout the year, you might have changes in medical, your medications might change, your doctors might change. And so it's good to kind of get a review. We send out a campaign and a link for our clients every August so that you can update your medications through a secure system. We can review that. We can take a look at the plan you have now and then recommend maybe some changes or if you're good. But nobody likes surprises. You don't want to come into the new year and all of a sudden you realize that a medication that you had covered is not covered in the new year. So that's important. And there's been a lot of changes in our industry over the last couple of years with the Inflation Reduction Act. So it's important, even if you're with an Advantage plan, you're going to want to go ahead and review. Okay. There's two other enrollment periods that you want to know about. One is called the open enrollment period, and that's for somebody that's already on a Medicare Advantage plan, which we'll talk about in a minute. That's option 2. And that gives them the ability through January through March to make a change. They can go to another Medicare Advantage plan, or they can go back to original Medicare. So if you missed your opportunity through the annual enrollment period and you're on an Advantage plan, you actually have 3 months at the beginning of the year to make a change between Advantage plans or go back to original Medicare. Okay. The last one's called the general enrollment period, and that's for someone that missed their initial enrollment period, which you don't want to do, and they're going to pay a penalty for life on their Part B premium. So you definitely don't want to miss that. That is for the first 3 months of the year. So if somebody missed their initial enrollment period, then they can go ahead and enroll in original Medicare January through March of the new year. Okay. So let's take a look at the 4 parts of Medicare. We've already talked about the first 2 parts, original Medicare, Part A and Part B. Then we're going to talk about Part C. Part C is your option 2. So Part A is original Medicare. You're going to add a supplemental and a Part D prescription drug plan to that, and that's going to make you whole. Or you're going to go with option 2, which is going to be an Advantage plan, or what's called Part C. It's like an HMO. It includes Part A and Part B, and also includes a drug plan as well. So it's very comprehensive. So let's take a look at the costs before we move forward. So for original Medicare, you've got deductibles that need to be covered. You also have coinsurance, and there's no out-of-pocket maximum. So you're going to go ahead and cover that either through a supplemental, if you're going to stay with original Medicare, which is option 1, or you're going to go with an Advantage plan, Part C, which is option 2, and that will cover those out-of-pocket costs in original Medicare as well. Okay. So those costs, Part A is your hospital insurance again, and that has a deductible of $1,736 for 2026. And all of these numbers are going to go up a little bit every year with inflation, okay, just so you know. But with the Part A deductible, it's not an annual deductible. So if you had a really bad year and you were in the hospital and then out for 60 days or more and then went back in, they're going to charge you that deductible again. Okay, so that's why it's going to be important that we cover all these costs for you. Okay, Part B, on Part A, on your coinsurance, if you're in the hospital past 61 days, there's also a copay there. We're going to show you how you're going to cover that. And then for Part B, which is your medical insurance, you're going to have a small deductible of $283 for your Part B, and then 20% coinsurance as you use services. And that's on original Medicare. So whether we go with a supplemental in Part D to make you whole on original Medicare, or we go with an Advantage plan to make you whole, they're both going to cover all these costs. The only out-of-pocket cost you'll have would be if you went with an original Medicare and you stayed with a supplemental, you would have this one cost of Part B of $283. But we'll go over that a little bit more here in just a bit. Okay, so here's your two options. I'm going to make it real simple. So original Medicare, option one. If you're on a PPO plan now and you like a PPO because it gives you the freedom to go to most doctors and hospitals within their network, you're going to love option one, which is original Medicare. And then you're going to add a supplemental plan that's going to cover your out-of-pocket costs, those deductibles and coinsurance that we just talked about. And then you're going to add a Part D prescription drug plan so that you've got a comprehensive plan. So that way you've got all your bases covered. The other option is the Advantage plan. Okay, this is option two. And an Advantage plan works just like an HMO. It's called Part C. So you got three different names for the same thing, right? And so it covers Part A, Part B, and also covers a drug plan. So it's what you're used to. If you're on an HMO plan now, either through an individual plan or through an employer, it includes a drug plan. So this is going to be exactly the same. Okay, so these are your two options. So let's go ahead and take a look at the Part B premiums. So this is what I was talking about earlier, is that you don't have a premium for Part A, but you do for Part B. And Part B starts off at $202.90, and it's based on your income. So if you're making more than $218,000, for example, on your joint tax return from 2 years prior, they're going to charge you the rate that goes with the amount that you actually had on your tax return. They look 2 years back to determine, based on your tax return, your adjusted gross income, to set up what your Part B premium is. So if you made $218,000 or more, you're paying $284, $274, $405, so on and so forth. And keep in mind, we'll take a look at this in just a minute, but with your if you're paying $284 or more, you're also going to pay a small Part D premium in addition to Social Security. So we'll take a look at that as well. Okay. So again, here's your two options, right? Right now, on a commercial plan or an individual family plan, you're either on a PPO or you're an HMO. The PPO gives you the freedom to go to most any doctor, hospital within that network, and they usually will give you in-network and out-of-network coverage. So there's a higher cost, obviously, if you go to out-of-network provider. But people like this plan because it gives them the freedom to travel and not be tied to a primary care physician and have to go through referrals and some of those things. So you usually pay a little bit more for this type of plan. And then the other is the HMO. And HMO, you've got a primary care physician that directs your care. He's part of a medical group that's attached to a community hospital. And so you have to get a referral sometimes to a specialist. You have to get prior authorizations, things like that. However, generally the cost of using that plan is much lower, but you don't have the freedom that you would with a PPO. Now, I will say that here in Southern California, we have one of the best HMO networks anywhere. So when you get to Medicare, if you're on an HMO, your plan's going to get better. If you're on a PPO, your plan's going to get better. They're both excellent options as we move into Medicare, and we'll take a look at those in just a minute. So here, let's take a look at option one. So option one, you've got original Medicare, and then you're going to add a supplemental plan that's going to pay for your coinsurance and deductibles and your out-of-pocket costs, and your Part D, you'll add a Part D drug coverage. Your other option is the Advantage. So let's take a look first on how a supplemental and original Medicare plan will work. So when you, with original Medicare and a supplemental plan, you're going to go to your doctor, you're going to give them both cards, your original Medicare card, and then your insurance carrier supplemental card. And then the provider is not going to charge you anything. They're going to bill Medicare. Medicare is going to go ahead and pay their portion to the provider and then send that bill on to the supplemental company, and that supplemental company will go ahead and pay that balance to that provider. Now, keep in mind, if you're on a supplemental, your only cost as you're using the health side of the benefits is you're going to have a $283 deductible, and that's an annual deductible for Part B. So at the beginning of the year, you're going to pay through that 283, and then you're going to be done. So it's pretty nice. So you might get your explanation of benefits for the first time you use the plan in the year. You're going to pay through that 283 deductible. After that, the explanation of benefits is going to be zero to you. And the nice thing too, when you go to original Medicare and a supplemental, you can go to any doctor, any hospital in the nation that takes Medicare. And the insurance company is not involved. They just, if Medicare pays, they pay. So there's no prior authorizations, no oversight, anything like that. So if you like what you're on now in terms of a PPO, you're going to love original Medicare with a supplemental. Okay. And again, these are the different costs that it covers. It covers all your out-of-pocket costs, your deductibles, your co-insurance, your out-of-pocket maximum, and it even gives you some travel insurance, which we can talk about. Okay. Your option 2 is your Medicare Advantage plan. So Medicare Advantage plan, it works just like an HMO, right? It covers Part A and Part B, as well as includes a Part D prescription drug plan. Okay, so if you like your HMO, you like your doctor now and your hospital and that sort of thing, you're going to love an Advantage plan because you're not going to have any deductible, generally speaking, with most of the plans here in California. You're not going to have a premium with most of the plans here in California, and it's going to include drugs and extra benefits like dental, vision, some of those things. So let's take a look. So your Medicare Part C or an Advantage plan covers your Part A, it covers your Part B, and then also gives you a drug plan and includes your includes gym membership, hearing, dental, vision, and some other extra benefits as well on some of the plans. Okay, so these are your two options, right? It's not difficult. They're just called different things. So you're going from a PPO to original Medicare plus a supplement, or you're going from an HMO to an Advantage plan, which is basically an HMO. So everything would remain the same, except your benefits would improve, and you're not going to be paying any premium. And you'll really like either one of these. I just have to say they're excellent benefits and excellent options for you. So let's just kind of run through it. This is the comparison between original Medicare and Medicare Advantage plan. So with original Medicare here, you can go to any doctor, any hospital in the nation that takes Medicare. It does not include prescription drug plans, so you would have to add a Part D plan, which we talked about. It doesn't include extra benefits, but you would add a supplemental, and sometimes you'll get like gym membership, something extra there. It has 20% co-insurance and deductibles. That's why you're going to add the supplemental plan. It's going to pay for these things as well. So original Medicare plus your supplemental plus your Part D, that's your option 1. Okay. Option 2 is a Medicare Advantage plan. Your Medicare Advantage plan has a network, and it includes a drug plan. It includes extra benefits like dental, vision, gym membership. It includes a very low out-of-pocket, generally under $1,000, and it cannot be combined with a Medigap or supplemental plan. And the prescription drug plan is going to work similar to what you have now, either on your PPO or your HMO. You're going to have copays. Generally for generics, you have a preferred generic, a regular generic. Generally those are going to be, a few dollars on up to $20, depending on what tier and what the medication is. And then you're going to have a deductible on that you would pay for brand names or non-formulary brands. But generally it's going to be a 25% in that category. It could be co-insurance, but most of the time it's co-insurance at 25%. And then you've got an out-of-pocket maximum of $2,100 on your drug plan. So that's either built into the Advantage plan or it's separate with your supplemental plan. But it's going to work just like the drug plan that you had before. Okay. And as I mentioned before, when you're making a higher income for Part B, you're going to pay a higher amount of premium. So you wouldn't be paying the $202.90 for Part B, you'd be paying, say, the $284. If that was the case, you're going to also be paying an extra $14.50 to Social Security as well for your Part D. Okay, so it's called IRMA, which is your income related monthly adjustment amount. So it's just it starts off at a base, and then based on your income, Social Security is going to be charging you a little bit more for your Part B premium and your Part D, based on what your income is. And they look 2 years back at your tax return to determine what your adjusted gross income is. And it will adjust every year based on your tax returns. So our services, let's take a look. How we help you. So we provide the Medicare education. We have the expertise and team, and we've set up all the systems and processes to know exactly what your steps are. So we help you not only through a 3-point system, which I'll explain here in a minute, but we look up your providers, we look up your medications, we do the plan reviews and comparisons for you. We help you with what the steps are and all the information you need each step of the way to make sure that you get enrolled on time, you get enrolled in the right benefits, and then we help you throughout the year through the annual enrollment period. And so you've got us hopefully for life. Hopefully we're earning your business and you like working with us. I mean, that's what we really strive to do. Okay. So here's our system that we set up, which I think works out really well. We have a 3-point system. First, we set up a 20-minute discovery call. And like I said, that's 3 to 4 months out prior to your birthday month or your retirement date. And so we'll set that up, and then it's just a call. It's usually about 15-20 minutes, and we go over kind of what you're on now, what you like, what you don't like, prescriptions, doctors, anything that we would need to know that would be helpful in determining what would be the best benefits and plans for you. Okay, so that's what we do, is we go ahead and gather that information, and then we'll go ahead and give you whatever emails you might need to be able to take the next step, in terms of maybe enrolling in Part A and Part B. And then what we'll do is go ahead and set up a presentation for you, which is step 2. We set up a personalized presentation, kind of what you're looking at today. We go through the basics of Medicare again. We go over the points that we've talked about here today. And then we go over what your options are based on the discovery call. So what plans and benefits might be a good fit for you. And then we can help you make a decision and get you enrolled. And we do that all online. It's very simple. And then the third step is what's called an orientation meeting. And in the orientation meeting, that's about 3 weeks after which you've gotten your enrollment kit, your card, and basically what we do is we just go through your benefits again with you, and we do it online again, and we'll go through those benefits, and we'll make sure that we answer all your questions, how to access all your benefits, and we actually put together a really nice PDF that gives you all the links to the extra benefits, the phone numbers, everything you need all in one kind of interactive document. So we really go and spend, go the extra mile to make sure that we're taking care of you every step of the way. You have all the information you need, and you're always informed and well communicated with, because this is our livelihood, and we want to earn your business, and we want to earn your referrals. And we think that we have put together something that you will want to tell your friends and family about. Okay. So just kind of looking at a cost summary here, and these are just rough numbers, but starting at $202.90 for your Part B premium. Okay, so everyone's going to pay that. So whether you go with option 1, which is a supplemental, or an Advantage Part C plan, you're going to pay the $202.90. Okay, and then if you go with the supplemental, you're going to be paying anywhere from $150 to $250, depending on age. and that's going to be for your supplemental plan. And then you're also going to get a drug plan. Most of them now, after the Inflation Reduction Act, are very little in terms of the plan premium, generally a few dollars or even zero on some plans, but they can be higher if you have a lot of formulary drugs that you're taking. You might want to pay a higher premium to get some of those other extra benefits, medications, formulary drugs in there. Okay, but most of the time, most of our clients are at zero or maybe $5 a month for their prescription drugs, but it all depends on the medications you're taking. Okay, so if you go with option one, you should be looking at about $350 to $400 per month. Okay, and your only out-of-pocket cost here is going to be your Part B premium of $283 in 2026, and then your copays for medications if you have some. Okay, if you go with the Advantage plan, your only cost here is going to be the $202.90. Okay, because it includes, it covers all your out-of-pocket costs, and includes a drug plan, so you're only at $202.90. Okay, so like I said, both really good options. And here in Southern California, HMOs are a great option for people, and supplemental is great for nationwide coverage, going to any doctor, any hospital that takes Medicare in the nation. So those are your two options. Those are services we provide. We would love to help you. We've got some links here below, and you can comment on that and like us. But we really appreciate your time, and we want to help you the best we can. All right. Well, thank you very much, and you all have a great day.